My name is Dr. Edward Setzer. I'm a cardiothoracic and vascular surgeon at East Falls Clinic in Idaho Falls. Abdominal aortic aneurysm is an enlargement of the abdominal aorta. It's defined as 1.5 times the normal diameter of the aorta. Normal diameter is 2 centimeters, and abdominal aortic aneurysm, therefore, is anything greater than 3 centimeters. The abdominal aorta is the major blood vessel leading from the heart down through the chest, through the abdomen. It divides in the lower part of the abdomen and then goes to the legs on both sides, ends up in your big toes. So it's kind of like a garden hose. And the enlargement in the aorta that defines an aneurysm kind of looks like a blister or a weakness in the garden hose, or a snake that ate a rat. It's a bulge that shouldn't be there. Because the abdominal aorta carries the majority of the blood supply to the lower extremities and to the lower aspect of the body, there's quite a volume of blood flowing through it. A ruptured abdominal aorta, therefore, is an immediately life-threatening problem. 50% of people will die before they get to the hospital. If they get to the hospital alive, 50% will die during the surgery. So therefore, survival for a ruptured abdominal aortic aneurysm runs on the order of 25%. Risk factors for abdominal aortic aneurysms are gender, with males being more at risk than females, as high as a ratio of 4:1, family history, hypertension or high blood pressure, cigarette smoking, race, with Caucasians being more at risk than African Americans, and age, particularly those greater than 65. Most abdominal aortic aneurysms are asymptomatic. The patients don't even know they have them. A lot of them are discovered as an incidental finding for a CT scan of the abdomen done for other reasons, ultrasound of the abdomen done for other reasons. Symptomatic aneurysms are those that cause the patient's symptoms, such as back pain, abdominal pain, flank pain. What most people don't realize is the abdominal aorta actually lies just in front of your backbone. So it's in the back of the abdomen, not the front of the abdomen. And the most common presenting complaint is back pain. The natural history of abdominal aortic aneurysms is that they will grow. They'll grow at a rate of about 2 to 8 millimeters per year. The risk for rupture depends upon the size at presentation, with 5.5 centimeters being the point at which we start looking at fixing the aneurysms in men. In women, it's smaller because they have a smaller body surface area, and so it's 4.5 centimeters. So we look at the size at presentation and we look at the rate of growth. For small aneurysms, and a small aneurysm is certainly anything less than 5 centimeters in a male or 4.5 centimeters in a female, we follow those. The best means of following those is with abdominal aortic ultrasound. As they get larger, for more definition to determine how we can fix them, we use CT scans. A CT scan gives a better evaluation of the anatomy of the aorta, and it helps us to determine the best way to fix it. There's 2 ways to fix an abdominal aortic aneurysm. One is through the traditional open repair, and one is using an endograft. It's called endovascular aortic repair. The open repair is done through an incision in the abdomen or in the belly, and it extends from just below the breastbone down towards the pubic bone. The aorta, which lies just in front of the backbone, is then exposed. We place a cross clamp across it that allows us to open that aneurysm, and then we actually sew in a graft that mimics the configuration of the aneurysm. The endovascular repair is done through small incisions in the groin. It can be done through a single incision or incisions on both sides. And basically, it's like building a ship in a bottle. We use a graft that goes up inside the vessel and is deployed inside the vessel and seals against the wall inside the vessel. so that the blood supply is diverted through that graft and the aneurysm sac is not exposed to the pressure of the blood within the graft. Abdominal aortic aneurysms are just one manifestation of atherosclerotic disease. By atherosclerotic disease, I mean hardening of the arteries. It's the same thing you read about in the papers every day. It can affect any vessel in the body, but most frequently we think of the vessels in the neck, the carotid arteries. When they're affected, it can cause stroke. When the vessels on the heart are affected, that can cause a myocardial infarction or a heart attack. When the vessels that supply the legs are affected, that's PAD, peripheral arterial disease. At East Falls Clinic, myself and my partners address all those forms of atherosclerotic disease, of which abdominal aortic aneurysm is only one manifestation. If you'd like an appointment for an evaluation, you can call us at 208-535-4567.